In this video, we'll review the clinical anatomy of the hand. We will focus on the sensory and motor supply. The radial, median, and ulnar nerve supply the hand, and we'll focus on each of these individually. Starting off with the radial nerve. The radial nerve can be thought of as the extensor nerve, as it extends the wrist and the fingers. Its sensory input is to the dorsal 3.5 fingers. In terms of its motor supply, it supplies the extensor carpi radialis, longus, and brevis, which extend the wrist radial side, and as well as the extensor carpi ulnaris, which extends the wrist ulnar side. It also supplies the finger extensors that extend the thumb, and as well as the 2nd to 5th digit. Patients with injury to the radial nerve may present with a wrist drop. Here you can see the normal movement supplied by the radial nerve, which is wrist and finger extension. Should there be injury to the radial nerve, the patient will present with a wrist drop, given that there's failure of wrist extension. Moving on to the median nerve. The median nerve can be thought of as the flexor nerve. It flexes the wrist and the fingers. It supplies sensation to the palmar radial 3.5 fingers and the distal fingers dorsally. In terms of its motor supply, it supplies the flexor carpi radialis and the flexor pollicis longus. This is the flexor carpi radialis, which flexes the wrist radial side, and as well as the flexor pollicis longus, which flexes the thumb. It also supplies the thenar muscles, and as well as the FDSs, or the flexor digitorum superficialis muscles, and the FDPs, the flexor digitorum profundus, but only of the 2nd and the 3rd digit. These flex the fingers at the DIPJ. It also supplies the radial lumbricals, and the lumbricals flex the fingers at the MCPJ and extend them at the PIPJ. Abnormalities of the median nerve may present with a hand of benediction or an OK sign. We will quickly review the various movements supplied by the median nerve. It supplies the flexor carpi radialis, which allows for radial-sided wrist flexion, and as well as the flexor pollicis longus, which flexes the thumb, and as well as the lumbricals, the 2nd and the 3rd lumbricals, which flex the fingers at the MCPJ and extend them at the PIPJ. It also supplies the 2nd to the 5th FDSs, which flexes the fingers at the MCPJs and the PIPJs, and the 2nd and 3rd FDPs, which flex the fingers at the DIPJ. As a quick review, abnormalities of the radial nerve may present with a wrist drop. Should a patient have an injury to the median nerve, they may present with a hand of benediction. The patient is asked to make a fist, and the patient is unable to flex the 1st, 2nd, and 3rd digit when asked to make it. And this is what you would see, which is a hand of benediction. The 1st, 2nd, and 3rd digit remain extended. Patients may also present with an OK sign. This is a normal OK sign, where you would expect to see flexion of the 1st IPJ and flexion of the 2nd DIPJ. And this is an abnormal OK sign, where the IPJ remains extended and the 2nd DIPJ also remains extended. Lastly, we will review the ulnar nerve. The ulnar nerve supplies sensation to the ulnar 1.5 the fingers. In terms of its motor supply, it supplies the flexor carpi ulnaris, which flexes the wrist on the ulnar side, and as well as the FDPs of the 4th and 5th digit. It also supplies the adductor pollicis, which adducts the thumb and the lumbricals as shown here. It supplies the hypothenar muscles and as well as the interossei muscles, which are not shown here, which adduct and abduct the fingers. Patients with abnormalities of the ulnar nerve may present with an ulnar claw or a Froment sign. Movements related to the ulnar nerve include flexion of the wrist, as it supplies the flexor carpi ulnaris, as well as flexion at the 4th and 5th MCPJ and extension at the PIPJ, as it supplies the 4th and 5th lumbricals. And the ulnar nerve also supplies the 4th and 5th FDPs, which allows for 4th and 5th DIPJ flexion. Patients with injury to the radial nerve may present with a wrist drop, as previously discussed. Injury to the median nerve may present with a hand of benediction or an abnormal OK sign, and patients with injury to the ulnar nerve may present with an ulnar claw. These patients are asked to extend their fingers and fail to extend the 4th and 5th digits due to the lumbricals, which are supplied by the ulnar nerve, not being able to adequately extend at the PIPJs. So here there is hyperextension at the MCPJ, however, the PIPJ remains flexed. Patients may also present with an abnormal Froment sign. A patient is asked to hold a piece of paper between their thumb, and patients with weak thumb adductors will flex at the IPJ of the thumb in order to hold this piece of paper.